Good afternoon, everybody. My name is Adam Neuman. I serve as Chief of Staff and Deputy General Counsel to the Commissioner at the Big Ten Conference, and I'm joined by some of my colleagues, who I will introduce shortly. It's really a privilege to be at this conference today to discuss mental health and wellness. It's something that's very near and dear to the Commissioner's heart and very near and dear to the Big Ten's heart. So the Big Ten Mental Health and Wellness Cabinet, which each of our esteemed panelists is a member of, and they're actually members of our executive team, so they're the leadership group of our Big Ten Mental Health Cabinet, evolved in December of 2019. And the mission was to promote optimal mental health for our student athletes, seeking to positively impact the culture surrounding mental health in collegiate athletics. And promoting mental health and wellness was something that was an issue that the Commissioner in our office has stressed since the beginning of our tenure. Prior to COVID, the Commissioner had went on a bold, ambitious journey to see all 350 teams in the Big Ten Conference play. And along from, seeing revenue-generating sports and non-revenue-generating sports, it was a keen opportunity to really interact with student athletes and staff on campus to find out what really is making these student athletes tick, what are the issues, what's working well for our student athletes. I really would say that 90% of the conversations that I had with student athletes or with staff on campus centered around mental health and how either it was wonderful, they had a great experience with it, or there were not sufficient resources, or the pressures, or something that happened in their family. It really ran the gamut. And as we all know here, mental health is so idiosyncratic and can affect people in a slew of ways. And it was so critical for us to form a team of experts. And I think you'll find the wonderful qualities of this team as expert analysis here today. And we put together 32 members, 2 members from each schools, our member institutions, including our affiliate members of Notre Dame and Johns Hopkins. And the cabinet has been a highly collaborative group and a highly nuanced group. And when I say nuanced, in terms of practice, in terms of gender, in terms of race, it's a great collection of people that have administrative experience, that have some medical experience, that have training experience, that have all sorts of experience that have allowed us to be really successful. And some of our initial goals really were to create a network of people, a reliable base of individuals who maybe didn't know each other as well, that were really experiencing some of the same challenges on campuses. And at that meeting in December of 2019, it was really just invigorating to be around so many folks that really believed and understood the pandemic that is mental health and how much it affects this country and how important it is to us. Another thing that it was able to do for us was we were able to drop mental health in all sorts of different committees. So with our Return to Medical Subcommittee, or whether our Equality Coalition or people serving as Chief Infection Officers, it was great to have a mental health perspective and lens in all the things that the conference does, because mental health really, it affects everything we do. So a good example of that is when we thought about how we were going to quarantine athletes. Folks on this call were really instrumental in figuring out what's that going to look like from a mental health perspective. Imagine you're in a totally different state. You don't know anybody. You just find out that you're COVID positive. What's going to happen from a mental health perspective, not just logistically, how are we going to get that individual back to campus? The conference was also really instrumental in delivering an app called Calm to all of our student athletes. Something that we took the lead on from the group here was noting that we can't do it all together. It's not enough to have the 32 people on the call. We need something that's technologically gifted that could allow people when they're on the road or whether they're at home, that they could have some sort of mechanism. And Calm on our platform has now exceeded over 250,000 uses, which is pretty remarkable when you think about, from a sad point, it's remarkable that, we need that type of support, but it's been remarkable that we're able to provide that on such a large and at the same time, such a granular level. So at this point, I want to introduce the cabinet members that have joined us today, and we're so happy to have them. So first is Dr. Michelle Garvin from the University of Maryland. She joined in June of 2017 as the Director of Clinical and Sports Psychology Services. In her role, Dr. Garvin is developing a comprehensive mental health performance enhancement program for University of Maryland student athletes. And in this role, she provides individual therapy and performance enhancement sessions, conducts team workshops, and implements outreach and prevention programming. She works as part of a multidisciplinary team of sports medicine doctors, nutritionists, coaches, and administrators to provide coordination of care of student athletes. And additionally, she is the department's campus and community liaison for mental health and provides training and consultation for athletic department staff. Next, we have Abigail Eiler, a clinical assistant professor of social work. She is a licensed clinical social worker and educator of more than 15 years of experience working in tribal and non-tribal communities across the country and in Canada. In 2014, Professor Eiler started as LEO lecturer of the University of Michigan School of Social Work and joined the governing faculty in May 2018 as a clinical assistant professor. She teaches various interpersonal practice courses to MSW and PhD students enrolled in the school's MSW program, as well as provides instruction in the school's community, action, and social change undergraduate minor. She deeply values teaching about social justice and implementing its principles into her clinical practice. She utilizes an anti-racist framework and makes intentional strides to address privilege, oppression, diversity, and social justice theories, research, and practice central to her social work pedagogy. Randy Ballard was named the Associate Athletics Director of Sports Medicine in May 2016. He previously had served as the Director of Integrated Performance since September of 2015 at the University of Illinois. In his role, Randy serves as head athletic trainer with ultimate supervision over the entire athletic training staff. Randy has been a member of DIA's sports medicine team for 15 years. During that time, he spearheaded the creation of the Integrated Performance Team and has been on the leading edge of new technology that enhances student-athlete performance while maintaining the highest level of safety. Randy has worked as an athletic trainer for volleyball, cross-country, track and field teams. A 1999 graduate of Kansas State University, Randy earned his master's degree in kinesiology from the University of Texas in 2001. And finally, our last panelist, Dr. Brad Foltz, is a counseling and sports psychologist for Purdue Athletics. In this role, he provides psychological counseling, performance enhancement, psychoeducation, consultation, and team building services to student athletes, coaches, and staff. Prior to Purdue, Dr. Foltz had positions of head of athletic counseling services for Georgetown and assistant director of the University of Oklahoma psychological resources for OU student athlete program. During his time as a graduate student at Indiana, he also served as a sports psychology consultant with an athletic department. His clinical interests include mindfulness, anxiety disorders, mood disorders, sports and performance psychology, and identity development. So, as you can imagine, we have a wonderful panel today, a really wonderful team of and a great collection of people with different strengths and different attributes. And I think we should just kick it off. So welcome, everybody. Thank you for joining us today. And the first question I'll ask, which I think has been on a lot of people's minds, really has to do with working with student athletes during the pandemic. So I'll ask, and everyone feel free to chime in, not at the same time, of course, but what has it been like for sports medicine staff to work through this pandemic? And Randy, maybe we can start with you.
Yeah, I think for a lot of us, it's been a lot. I mean, on top of everything else that we were already dealing with, and we've talked a lot as a group. I think a lot of people are losing sight that we layered on one pandemic on top of probably one or two other previous pandemics, the global mental health pandemic, as well as the social justice and equality pandemic that we are facing as a country. And so, as sports medicine, typically deal with physical injuries to add on epidemic virus control and viral mitigation. It's been a lot for our staff to manage. And so it's been a lot. Today, the vast majority of our providers are in it for the love and support of our student athletes. And so it's been a challenge, but at the same time, it's been great to see them still be able to play their sports that they love a lot about. And as well as it's allowed us to have some other conversations and support them and open their eyes to things that this group is passionate about. From the time we sent them home during the pandemic to understanding what they were going home to in terms of family environments, in terms of their previous childhood experiences, in terms of how they identify as a person. It opened up the door for in-depth conversations. It made challenges for trying to figure out how to provide care while they were halfway around the country. But I feel like it's opened up a lot of doors, and it's made the bond and our student athletes even greater. And we're still working through it, but I'm really proud of what our conference and our staffs across this conference have been able to achieve to support our student athletes and allow them to play the games that they love.
Thank you, Randy. That's very insightful, and I think it probably leads into another question about that. And I'll pass this one to Michelle, Dr. Garvin. I apologize. Can you talk a little bit about the anxiety that's been going on for student athletes, and not just with the pandemic per se, but just in general in this atmosphere, I guess, whether it is COVID-19 testing and waiting for testing and the additional anxiety that's come on and what you've seen in your practice, if you can, to the extent that you're able to share?
Absolutely. So I think, across the board, anxiety levels have just been heightened. There's so much uncertainty right now. And I think that one of the things that I can say that I talk with a lot of people about is the only thing that's consistent is that life is inconsistent right now. And so I talk with athletes about, are you excited for your game this weekend? And I hear, well, I'll be excited when I'm on the field and I know the game is happening. There's just so much uncertainty. So there's this anxiety surrounding, will we play? Will we not play? And then you mentioned, Adam, with testing. So daily testing is a large part of our student athletes' reality these days. And so not only is there anxiety surrounding the time commitment that's involved in going to the site, getting tested and working that in with their studies and their other athletic responsibilities, but waiting to find out each day, is my test going to come back positive? Will it be negative? If it is positive, what happens? What will happen if I get removed? False positives have been a really big thing that I've talked with both individuals and teams about. Waiting the time in between getting one test back and waiting for the confirmation of whether they have a positive or a negative test has been something that we've seen a lot of. And so managing that anxiety is something we talk about. And Adam, you mentioned the Calm app. That's something that I'm really trying to use these testing times as we've got this built-in 15 to 20 minutes every day where your job is to sit in one place and wait. Why not build that in as a time to do some relaxation, meditation, mindfulness, grounding activities? And so really trying to use that to the student athlete's advantage.
Yeah, and I think that's great, right? Like making the connection between some of the things that I think the cabinet has discussed maybe in its own right, like this is great for sleep, but then to say, we can use it in other ways. And with that, I guess, would lead to another question. Abigail, I'll drop this one off for you. Can you talk about a little bit about like the student sacrifice that's been during this time period? Because I think it's been really a heavy lift. And I know Michelle just spoke about the anxiety, and maybe I think you could also, with your unique perspective as a member, I know of the Equality Coalition as well, maybe you could talk about how social justice has weighed into that. And I know there are certain things going on with war at Michigan and some of the avenues that they've chosen to voice their opinions and showcase their, I wouldn't say resistance, but their proud stewardship of what they want to be and who they are. So perhaps you could.
Sure, absolutely. I mean, I think at the end of the day, it's important for us all to recognize that we've had a lot of choice in terms of what we participate in, what we sign on to, and our student athletes, when they signed on to be collegiate student athletes, didn't anticipate that they would be navigating through a pandemic, which would mean that there would be a shift in expectations in order to keep themselves healthy, keep the community safe. We did see a lot of sacrifice in terms of now when we have people at games, right? So we have a very, very small amount of spectators that are permissible to attend at different events. We have parents coming, family members coming, and our student athletes aren't able to hug them. They're not able to, travel and leave on the weekends, right? If they have a weekend off. Those are all significant changes. And so those are some sacrifices that people have had to give up, and not just student athletes, but staff as well. When we had a 2-week pause a couple of weeks ago at Michigan, it wasn't just the student athletes that were quarantined, it was also all of our staff and all of our coaches. And so collectively, we have really band together in order to get through this, because it has been difficult in terms of the isolation and the reduction in some of those physical components that we thrive from, right? Talking to a student athlete to say, like, I haven't had a hug since I left my house in July, and that's hard. That's really hard. So we're trying to be as supportive as possible and staying as positive as we possibly can. As it relates to equality initiatives, we know that the NCAA passed legislation that is allowing for all of our universities, member institutions, to wear patches, social justice patches, and also wear shirts or anything that represents equality in social justice initiatives. And so at Michigan, we started Wolverine Against Racism, which was started by 2 members of the track team. And through that, they are really doing a lot of education. So when Randy talked about this, dual pandemic, right? So we're navigating all these different things. We've got to really consider how this has influenced and impacted our student athletes at a time when they can't come together collectively outside of something that's virtual. And so we're really trying to get creative with opportunities to, have discussions, intentional discussions, and be supportive as possible, because the sacrifices that the student athletes have made during this time are instrumental and something that I think we can all really honor.
Thank you. Thank you, Abigail. And we'll circle back to racial justice in a bit because I want to give that even more time. But Brad, I guess for your opening question, so to speak, I'm curious, you've always been, such a vital component of our cabinet, and you've always been an incredibly friendly voice, I think people would say. I'm curious how you would sort of articulate the importance of having a body of people that are really there to help. Has that, like, the collaboration between other schools, like what have you taken from them? What have you been able to provide from them? Is there anything that comes to mind? And sort of how has that helped you and Purdue really address the pandemic, sort of having now this centralized place where you have a body of people who, might be going through the same things as you, might have very similar cases. And as we know, like, student athletes is a very, very specific type of case. It's not quite like anything else. And that's very important. So maybe you could speak to actually both of those things. What really it is to treat and interact with student athletes and the additional pressures they have, and sort of what it's been like to now have sort of a few more resources at other universities that can help sort of, help this come along as,
Sure. So, I think Randy, Michelle, Abigail touched a little bit on some of the things that our student athletes are running into. I think one of the spots that I feel maybe was underrated that we didn't necessarily all expect when the pandemic hit was it created a massive identity crisis for all athletes at once. Whereas, a lot of times as mental health professionals or sports medicine providers, we will be planning for an athlete who maybe has an injury that takes them out of sport, potentially career ending or graduation. And we have a certain number of those we expect to graduate every year. We know those people will transition out of sport. And a big part of the challenge that can come with that is just what does it mean to their identity? For up until they're 21 years old, they identified primarily as a student athlete. And then they lose that pillar of their identity when they graduate or get hurt. And usually we're ready to handle those athletes coming through. I don't think anybody in the conference, any of our mental health providers are ready for 500-600 athletes all at once losing part of their identity. And that created a massive amount of just adjustment challenges and anxiety and depression and all these new risks and new things that came about with just a new influx of challenges of who they felt they were. And I think that has been a big part of what's been helpful about us having the mental health cabinet and the different committees is we have started to take those actions to try to hit all of these athletes at once as much as possible, to get as many resources and many things in their hands as possible. I always tell people, I joke around about it, but I feel like I'm a salesman for COM at this point because we use that so much. And that's why I'm super proud to hear the numbers that you talked about 250,000 people utilizing that resource as a way to help manage some of the distress they're going through. I know myself and our other psychologists here at Purdue, we utilize that in our treatment daily, weekly with all of our students. And to speak to your other question and how just the resource that the committee and the cabinet has created, I think I can speak for Michelle a little bit of every year we have a sports psychology conference that a bunch of us attend, and that's like a big jolt in the arm. We get together, we learn new things, we get excited about new things. I know every year I come back and I have all kinds of new initiatives and plans and everything put in place. The downside of that usually is it's once a year. And so by the time you get 10 months in, that energy is still not quite as there as much. And one of the things that's really been helpful about the collaboration that we started establishing is we get that once a month now, or once every 2 months, or however we have meetings or subcommittee meetings. And I know it's helped me with looking how to respond in new ways to the pandemic, identifying ways to reach out to our student athletes who test positive or have to quarantine, things that I maybe hadn't considered that my colleagues can teach me. But also, I think an underrated thing, and I know this is something Randy has expressed passion about too, it wears people down within our department, our staff and our administrators and everybody else. And so it helps me to have colleagues throughout the conference. I know I can text or call anybody in the cabinet and ask them for a question about how to manage something that's challenging, just to kind of get things talked out a little bit if I need to. And I know that there's people throughout the conference that benefit from it as well. The other thing, I think what it's done is, especially because it's coming from the conference side of things, is it really is just, I think it really has stoked a lot of passion and a lot of buy-in that it can take a little bit of time to make these things happen individually. At Purdue, I might have an initiative I want to do, and I have to really put in some groundwork to work on administrators to get them paying attention to a certain idea, a certain issue, or the different pandemics that Randy was speaking to a second ago. But when it comes from the conference side and the commissioner's side, and not to pat you on the back, Adam, but when it comes from you and that email comes from you, it gains people's attention. And those things really help us move things forward. I think it just opened up new conversations and made things happen for us in our department that would have taken me a little while longer to get. So it's really made a big difference just in the short time we've been able to put all this together.
Thanks, Brad. And I couldn't agree with you more. I think there's strength in numbers and there's strength in, unifying under one umbrella to really try and tackle some of these solutions. And I think that's really critical. I think what's also interesting about the cabinet and what's interesting about the call map and all these different things is, and I've mentioned this, I think, to Abigail privately, but I'll share this publicly in this forum. The knowledge that something exists sometimes is a very, very warm and settling feeling. So even if I'm not on Calm every day, but I see that that app is on my phone, and even if I don't talk to Brad or Randy or Michelle or Abigail every day, but I know the conference is in great hands because there's a cabinet that does that, there is a certain sense of security that brings. And we've heard that from a lot of different people. So there's this knowledge now that the conference is taking a very strong stand on mental health and doing their best to try and move the dial, whether it's a presentation to the chancellors and presidents or a few of the other things that we're trying to do, hopefully in the fall. I think there's a powerful feeling that mental health is being addressed in a real way, and there are people that are really backing it up. So I think that's really critical. So moving on a little bit to integrated care, and I think this will go for Michelle and Randy. Can you describe the structure and the special considerations for integrated sports medicine departments?
I can get started with that, and Randy, you can fill in also. Just kind of thinking about it. We really work as a collaborative team. And so even on this call, you can see people from different disciplines and from different parts within sports medicine. And especially when we're thinking about COVID, this is a physical health condition. It's also something that's really strongly impacting mental health, as we all know, and that's why we're here discussing this today. But there's a lot of other components too. And so even just thinking about how we care for the student athletes, I think a good example is a student athlete who might end up testing positive and ending up in isolation. Well, the athletic trainers are checking in with them on a daily basis. The team physicians are constantly making sure they're okay, monitoring their physical well-being and health. Our dietitians are coordinating meal plans for them to make sure that they get the appropriate nutrition. And our mental health providers are checking in regularly to make sure that mental health-wise, they are staying connected, staying positive, and taking care of themselves. And so I think COVID provides a really great example of how we can be a really integrated team. Just that one example shows all the different disciplines that can work together. We do that from an injury perspective as well, but I think it's really important to have everyone on board working together collaboratively for the overall well-being of our student athletes.
That's a great example, Michelle, and thanks for sharing that. I think the other interesting piece, and when you have a conference as large and diverse as the Big Ten, you see each institution kind of has their own structure. The Big Ten and the NCAA mandates medical autonomy and authority to make medical decisions, but how each institution goes about providing a medical care team is different. Here at the University of Illinois, our athletic trainers are employed by the athletic department. Our mental health providers and our team physicians are employed by a separate third-party healthcare hospital group here in. And so each of our institutions may have some different structure, but at the end of the day, the collaboration and the communication amongst our teams are essential to support our student athletes. And I think that's been one other huge positive aspect of COVID. I think for all of us, we've all tried to find the positives, brightness in some of the dark places. And a couple of the big positives that I have seen is just that collaboration and communication increase amongst just in the situation that Michelle acknowledged, between nutrition and mental health and athletic training and team physicians and even sport administrators and coaches. But the other piece of that too is I think even just that collaboration across our conference on our mental health cabinet. We have representatives from senior women's administrators, faculty advisory reps, the gamut of mental health professionals and sports medicine professionals and conference office personnel. And so for me, it's been great to get to know and to hear perspective. I think it's very easy for us, even as professionals, as adults, to think, let's say for a student athlete, I think I know what a student athlete may be feeling or dealing with, but until you include them into the conversation or until you include the FARs or the other professionals into the conversation, you're going to have your own bias and you need to listen and hear their perspective. I know a scope of practice is a very hot topic across a lot of medical fields right now. And I think we have to find the common ground and then also figure out how we can support each other to best support our student athletes. And so while each institution may have their own model, at the end of the day, it's how well we can all work together to provide the best support that we can for our student athletes.
Thanks, Randy. And I'll follow up with a question that I've found. I've worked here now for a year and 3 months, and I've found that sometimes the hardest balance is when you're trying to make one policy for 14 universities, but the 14 universities don't do the same thing. So I'm curious what this group thinks about sort of the parameters for how you draw that line. So you look at something like Calm, and you see that, Michelle is using it different than Brad, but they're both successful at Purdue and Maryland. And that's terrific. That's like everything you want, I think, when you're trying to draw something out. But then there are certain items where it's like, no, it's really better off if the school handles that because they know how their student body reacts to it better. So I'm curious if people on this chat would be willing to sort of, I guess, opine a little bit more on what are items that are really something that as a conference we could unite as, and what are things that are probably best really still done on a university by university, and sometimes even more granular on like a case by case, on a team by team basis. Maybe the volleyball team really needs this, but the basketball team really needs this. Like, how do we come up with those nuances and those policies from a global way and from a granular way?
Well, I think, so I'm someone that loves data, right? And sending out surveys. I think that's one of the things that I'm probably notoriously known for. And I think it's important that we look at surveying our communities. Now, I think when we look at our mental health cabinet, there's so much investment in destigmatizing mental health. There is a lot of care, compassion, and effort that's being put into education related to mental health. So we're getting ready to start our new initiative for coach and staff education to help better support our student athletes. And I think those are things that we can do collectively. I do think that each of our respective institutions have our own little nuances and our own little things that are going to be really important. And then, Adam, you also brought up, sports look differently. So when I think about the racial composition of different sports and what the different needs may be dependent upon race and gender, those are things as medical providers that we have to consider. One, it's getting that information from our student athletes about what types of services or what types of support might you best respond to, and then being able to find a way to establish those things so that our student athletes get the best possible care that they can, and then also ultimately have the best mental health outcomes and health-related outcomes moving forward.
Thanks, Abigail. Any other thoughts on that before we move to another question?
Yeah, I think two other things that I would add is one, I think just really focusing on the end goal. In the Calm app selection, while there was some differing opinions, really the end goal was to get something that was easily accessible that our student athletes, no matter, even if it was internationally, that if they went home because of COVID, they had something they could access on their phone. And so sometimes it's best to start with the end goal in mind. And then work from there and figure out, okay, for this institution, these might be the rungs on the ladder to get there. And for a different institution, it may be we're having to put an escalator in to get there. And so I think really focusing on the end goal initially sometimes is really beneficial. And I think something that we've talked about as a cabinet is just, how do we raise all the ships? I don't recall the correct line about raising all ships, but if there's an institution that we can all rally around to help support, be it from a provider to student athlete ratio, then how can we help that institution raise up what we need to do? And so how can we support each other to accomplish shared goals and shared desires for all of our institutions and all of our student athletes?
And if I can add something real quick too, Adam, something we have to keep in mind when we do this is that, part of your answer to your question is it's cultural in nature, right? Each of our departments has its own unique culture and view and appreciation for sport or what sport means and all these different aspects of athletics. But even within each of those teams represents their own small culture. They all have their own ways of talking, their own ways of believing, and how they handle and respond to things. So that's why some of these things can be like, even we talk about these larger initiatives we're talking about, how we roll them out, how we do them is going to be different per team, in each individual department within our department. So I think those are things you have to keep in mind. That's why we can't just take that one size fit all and just try to do it the same all the way across the conference, even though I know it would make a lot of less work for a lot of people if we could. But we have to keep those things in mind when we do this. And I think this goes not just for athletics department. I think this goes for a university. You have to understand each individual area you're talking about is going to have its own culture and its own way of doing things. So that's why I can feel like you have a great plan, works with one area, and then you take it to a different team, it doesn't work the same way. You have to be responsive to those kind of needs.
Brad, does geography play a role to you in that? Like, I wonder, like, is there huge differences between the kids that are in Ann Arbor versus the kids that are in College Park? Or do you feel like that's not necessarily because they're coming from all over the world? Or do you sense that, geography is a factor, kind of like what people are?
Yes, I think there's a couple of ways that impacts it, right? I think, I've had the fortunate opportunity to work at different areas of the country, and I will tell you that the culture of the athletes coming in is a little bit different. A Georgetown student is different than an Oklahoma student. It was something you sort of catch a little bit of a vibe, just the way they saw things was a little bit different. But then even within it, right? So when I'll speak about my experience at Georgetown, you may have one team that is a very affluent population. That's the culture of that sport. But our football team wasn't made up of affluent students. They were students who came from much more difficult locations or areas or experiences, or didn't have the same resources. So some of it can be geographic. I think it also can be, and I can't speak to the students in Ann Arbor, but I'm sure that Abigail will say they're better than Ohio State and all those other things that go with it, right? But I think that happens too. I think you start to see students here. Some of our athletics department, when I speak to some of our students who are pursuing majors in agriculture, like agricultural engineering, that attracts a certain type of person, has a certain type of personality or interest in that a school like Georgetown or maybe Ann Arbor doesn't have that major, so those students don't get attracted to that school. So I think location can have an impact on that. And I'll speak to my own experience here at Purdue. I live in West Lafayette, is a predominantly white area. And so there's not much racial diversity and ethnic diversity in our area. So that is a big challenge for a lot of our student athletes of color, no matter where they're coming from. They come in and this is not a very diverse area. This is a new challenge for them to try to learn how to navigate. They've never seen a corn silo in their life. And now they're trying to figure out how to survive in this new environment with people who don't connect with them. And they don't feel like they have their place outside of their team. So it's a long answer to say yes. I can't say specifically certain geographic areas are going to have certain challenges, but it definitely seems to make a difference in the impact of what they're experiencing and what they have to cope with and adjust to when they get here.
I'll piggyback on
Thanks,
that.
Brad. So our next question the
last thing, just because you brought up sport, and I think this goes along with what Brad is saying, is I think with the evolution of youth sports, I think the socioeconomics of youth sports and club sports is changing some of that team-by-team dynamics in terms of how much it costs to play, let's say, travel volleyball or some of these sports. And so the socioeconomics piece of what sports looks like currently and into the future is something that we have to be understanding of, and how that affects both the experiences as well as the diversity of those respective sports. And so I think there are a lot of factors besides geography and race and sex. I think socioeconomics is going to continue to play a huge role in sports, especially as we see the over-commercialization of youth sports as we move ahead.
Thanks, Randy. So the next question I'll direct towards Abigail. Can you give us tell us a little bit about the programs and services that are provided for Big Ten student athletes across campuses, I guess, at Michigan, but of course, across all of our 14 institutions, some of the things that we would come to expect at these places.
Oh, yeah. Let me see if I can share my screen real quick. Possibility. We'll see if we can navigate through this. If not, I'll just speak to that. Because I think that's going to be really important to understand. There's such a large amount of services. Yeah, it looks like it's not sharing, which is okay, that we provide just throughout the Big Ten. So we collected a lot of data last July and have continued to reference and look at that data as it relates to different services that we're providing. And I think we got to remember that this is a spectrum of care. So while a lot of people are coming in for mental health services, we have a large number of people that are coming in for one-on-one performance consultation. We have people that are coming in for team sessions. We're going to teams for team sessions. So team interventions, conducting mental health screenings, providing education and outreach. Telehealth obviously was something that has been very big during this pandemic, and 100% of our member institutions are able to deliver those services. And then most of the other services between performance consultations, group therapy, coaching consultations, supervising trainings, because a lot of us also have postdocs, we have MSW fellows, we have counseling fellows throughout our institutions. And so we see a lot of services that are being provided to our student athletes in a multitude of different types of modalities. So from cognitive behavioral therapy to exposure work. We have some places that are doing EMDR, which we're utilizing also for performance, not just for processing trauma. So I would say when we look at the gamut of services that are being provided to our student athletes, not only are they evidence-based, evidence-informed, they're also culturally responsive, because we're able to make the adaptations not just for sport, but also for race and ethnicity and gender. And I think that's really important, because that's an area that's highly under-researched. And so we're able to do what we need to do to, one, stay with fidelity, but most importantly, meet the needs of the person that's in front of us.
Thanks, Abigail. You mentioned under-researched. Why do you think that is so? Like, what makes that area?
I think there's a bunch of reasons. One, it's really hard to collect data at times with student athlete population. It's really a kind of a tight circle of people that do have access to some of that information. So I think that's one piece. I think the other piece, again, kind of speaks to what Dr. Foltz was talking about earlier. We have different needs throughout our institution, and because of the number of services that are being provided, I think across the Big Ten and our member institutions, we provided over 24,000 appointments in a year, and that was in a year with COVID. So, there was a lot of disruption to services. So I think time is one area. I also think that a lot of us here, we're practitioners. Right? So, our primary role and job is to ensure that we are working one-on-one or with teams. And so there hasn't been a lot of time for those that carry the expertise to also be doing the research at times. And then, of course, we've got funding, right? So, I don't know about the other member institutions, but I will say that some of my staff are seeing between 35 to 45 student athletes for individual psychotherapy or performance work every week. That's a really high caseload. And so when you think about that, and then in addition to researching it, there just hasn't sometimes been the time, which is why I think the cabinet presents as an opportunity to collect the data and then to put that out there so that we can help educate the profession and those that are working with student athletes that may not be embedded within the athletic department.
I wanted to add also
Thanks,
to what
Abigail
spoke about in terms of what services are being offered. We talk a lot about what we do within our programs, and also one of the big roles I know here at Maryland, and I know many of the other institutions serve as well, is making sure athletes get connected to the services they need, even if we don't offer them within athletics or within whatever department we're hosted within. And so I know case management and finding the appropriate referrals and resources is a big part of what we do. I think sometimes we do think about athletics being very contained, but if we don't have what a student athlete needs, we certainly are going to do the work to find it. And so that means collaborating with the campus community as a whole, but also with the larger community surrounding our institutions. And I think that goes back to your question about geography too, also, Adam. I think some of the resources that are available at our different member institutions are based some in the geography of where the school is located. So we are located near a couple different metropolitan areas. So I would imagine we'd have more access to some specialized resources than maybe Iowa would, being not as urban, I guess. And so thinking about that, but also one of the things that has come up in some of our meetings is that this idea of telehealth has opened up resources to our student athletes as well. So people from anywhere within our states can now provide services to our student athletes. So I think that's just something important to talk about, really, if we can't provide the services in-house, finding those resources for our student athletes as well.
Thanks, Michelle. And Brad, maybe you can kind of take us home on this topic. What's missing that really needs to be improved to help working together?
I mean, I don't want to sound alarmist, but a lot. I think, and I think Abigail and Michelle touched on a couple of the really big ones that, at least I can speak from my personal experience, even just here in Purdue. Sometime a few months ago, I did a search for providers in the community. And we had 0 providers of color in the West Lafayette community, at least listed on ways you would normally go about finding. Now, there may be people not listed, but as far as I could see, there was none. And so we have student athletes who would likely benefit from being able to have providers of color available to them. They might feel more comfortable and seek out resources, seek out support that they may not be as comfortable working with a white male or whoever it is we have on our staff. So that's a limitation. And Michelle kind of touched on that. Part of that is location. We are an hour away from Indianapolis, 2 hours from Chicago. But even still, the fact that we have a hard time keeping folks in the area of different ethnic cultural backgrounds is a real challenge. And hopefully, as we go, and Michelle was mentioning, if we can extend some of those licensing guidelines, allow some interstate practice or long distance telehealth opportunities, that may open up more opportunities for our student athletes. One of the things that has small positive of the pandemic is it really accelerated the growth of telehealth services. At least I don't think many of us were doing anywhere near the extent of telehealth services, if at all, until this happened. So that's going to be an expansion that we're going to have to keep looking at it, how we're going to get those resources into their hands and expand it a little bit further. I think another thing we need to grow and have more access to is specialist providers. And maybe, again, this might be partly geographic, but we have very limited access, at least in my area, for things like ADHD or learning disorder assessments. So we are taking that on in the athletics department, which, to try to help our student athlete population collaborate with our sports medicine and our academic staff. The downside of that is those can take, 3, 4, 5 hours of time. As Abigail said, with just 2 of us, that's, 4 or 5 potential student athletes who aren't coming in for individual services. So now what do we do with those folks? So I think that becomes a new challenge. And I think, we have to keep looking at, and part of it's funding, like Abigail said, or other ways to get more resources, more providers available to us. I think one of the things that we're going to have to continue to do, I think this goes for college mental health in general, is keep pushing to decentralize the way our services work. I think one of the things you're starting to see nationally is you'll see counseling centers start sending providers into a specific school or another place on campus, as opposed to being one centralized location. I think that presents a barrier for some students to get resources or to get treatment that they may need. I know we're housed in our sports medicine area, and a lot of our athletes have easy access to it, but it's also an area where some of them don't want to be in. They don't want to come down there. They're worried about people seeing them, or they're worried about the stigma that walking back to where our mental health offices are. So decentralizing our services, having more availability in the areas where they are, places they're comfortable, are going to really make a big difference. Those are all things that we need to get better at. And I don't know if there's a great time frame on it. And some of those things are more systemic when it comes to like the diversity of providers and those type of things. But what's great about it, I think, again, kind of touching back to our mental health cabinet, having this bigger voice, is I think we can push for this change to happen a little bit more. It's easier to have that when you have the rest of the folks behind you.
Thank you, Brad. So that'll take us actually to our won't be our final topic, because we got a lot more to talk about, but maybe one of our final topics of the day, which will be racial justice initiatives to support mental health. And Adam Kern, whoever you are, thank you so much for your questions. We're going to integrate them right now and talk about those. And I don't know if that's because I'm biased and both our names are Adam, or because you're the person that wrote the question, but anyone else who has questions, we can try and get them in. So they're better than our questions. We want to hear from you. So thank you so much. So Abigail, I'll kick it to you for the first question, which will be, what role has the Mental Health and Wellness Cabinet taken as it relates to racial justice initiatives? And I know you touched upon it earlier. And then I think Adam's question is brilliant. And I think probably everybody here, I don't know if we'll have time for everybody to respond, but if you look in the chat, he asks, he had a question about this dual pandemic and about the differences between mental health students of athletes of color versus white students, and then sort of specifically what we're doing to to do that. I know we did a seminar on racial trauma and things of that nature, but I'll leave it to you, Abigail, and then of course the panelists feel free to weigh in, because I think that's a terrific question.
I mean, I think a big thing obviously was recognizing that there needed to be more education about providing services to students of color, more specifically student athletes of color. And it was something that the mental health cabinet felt very strongly about. So we did last, at the end of the summer, did a hour-and-a-half long training talking about racial trauma and the mental health implications of that. The other thing that the mental health cabinet has spent a lot of time doing is on a monthly basis, we send out surveys, we collect, what types of services are being provided, and that extended to what types of social justice and racial justice initiatives are you doing at your schools and institutions, creating a mechanism and forum for us to be able to brainstorm with each other, talk to one another, and build different services and resources to respond to what our student athletes and what the greater community and country were experiencing at the time. So I think those things have been really important to the cabinet. Can you repeat part of Adam's question again, just so I make sure I cover it? Can you repeat part of Adam Kern's question?
What did you say? Sorry. Sure, of course. So he wanted to know thoughts, data, anecdotes about the differences in the mental health of student athletes of color versus white student athletes. And then additionally, what's specifically done to support the mental health of the student athletes of color on a micro level, on a macro level.
Yeah, I mean, I think one of the things that we're seeing is, and Brad hinted at this a little bit, but increasing access to diverse providers. We know that there is data and research out there that suggests with racial matching for providers actually not just increases the likelihood of somebody reaching out for services, but also the retention of maintaining and continuing with services. And that has a significant impact on, someone's overall mental health outcomes. So that's something that not just the cabinet, but different institutions across the country have really started to consider and look at increasing access to a larger pool of mental health providers that our student athletes have access to. The other thing is just creating that space to process, right? So that people can talk about their experiences, what's going on for them, whether that be individually or collectively. At Michigan, we've put a really heavy emphasis that's been driven by our student athletes on unity. So it's a space where student athletes are coming together, they're talking about what's going on for them, and then gaining the support from one another. So it looks different at each institution, but I think anecdotally, we are stronger when we are together. We heard that earlier today in the first seminar, and our student athletes believe that. These are team-oriented individuals. And so while there are differences, differences of experience, we talk a lot about microaggressions that our student athletes of color experience. I'm a firm believer of being strengths-based, and so educating people on micro affirmations and how do you give those affirmations to people to uplift and to help produce better outcomes is important. So those are some of the things that we're doing and different experiences that people are having.
I would add, I'm sorry.
Thanks, Abby.
I would add too.
Sorry, go ahead, please.
That would be partly where the role of our initiative for the coaches education at the Big Ten level is hopefully going to help play a role. I know that speaking with, oftentimes it's our male student athletes of color are the ones in most underutilized services. And a lot of times when those athletes start coming in, it's because a coach advocated or has a value for mental health or saw it as something that they wanted to push or support. And the teams that I've seen that don't do that are usually, you can trace it to a coach who says, and they've said it to me directly before, I don't believe in psychology, or I don't believe in mental health, or I don't, and see it as something that is just a made up issue, a made up concern. So I hope that, the initiative we have at the mental health cabinet with doing the coaches education will help get some of that information in the coach's hands so they can advocate for us. We're not going to have, and I think Commissioner Warren has said he wishes we could have a mental health provider for every single athlete that we have on our campuses. We're not going to ever have that, but we do have a coach that sees these athletes, 20, 30 hours a week potentially. And if they are the ones that can help advocate and help them see that they trust us, they trust the providers and resources in their athletics department, just like they would their strength coaches or athletics trainer, that'll go a long way to help bring some of those barriers down and help those students come get support and get the care that they need.
And to address
Thanks,
your
Brad.
question, Adam, about some data and what we're seeing out there, the NCAA did conduct a study. They conducted 2 rounds of it, once last April and May, and once this past fall in October and November, looking at the impact of COVID-19 on the mental health and well-being of our student athletes. And not surprisingly, kind of what we're seeing nationally, but the distress rates, mental distress, things such as sadness, sleep difficulties, anxiety, were heightened across the board to the bounds of 1.5 to 2 times higher than pre-pandemic levels. And those among student athletes of color. And so there is some data out there to suggest that that those levels of distress are higher among student athletes of color as well. And there's some other information in those studies that might be great to check out if you're interested.
Yeah, and I think related to that, to piggyback on what Dr. Garvin said, is, you mentioned what's the difference is, and I'll give you a great example, and this is probably one of the things that contributes to that difference in anxiety. 2 weeks before we were to bring back student athletes, we had a Black football player whose mom was literally on her deathbed with COVID, and we had another student athlete whose grandfather passed away of COVID shortly before bringing them back to campus. And so supporting those young men through those situations, and then the first time that their teammates tested positive, and what that meant for them when they lived through that experience with their own family members, that was different. We had not had a Caucasian student live through those circumstances. We know COVID has been affecting diverse populations different than the white community. And so that was playing out in front of our very eyes as we were bringing back student athletes. And so thinking about how we best support them was essential. And how do we engage with them? How do we make space for them to say, I'm not ready to come back. I don't want to come back. I just lived through this with my family. I don't want to be in an environment where I could get sick. Those were all things that we had to take into consideration. And to piggyback on what Brad and Abigail said, we were very lucky, very blessed. We actually had worked with and identified a Black counselor to start working with our student athletes right before COVID hit and right before the George Floyd situation. And we have student athletes engaged in care that would have never come and knocked on our door, would have never reached out to any of our other staff had we not had James a part of our staff. And so I think we constantly have to listen and ask them, what do they need? We have to be aware, and we have to make space for that, to Abigail's point.
Thanks, Randy. We got a question from Stephanie Sutton, and her question is, with members of the collaborative care team for student athletes having different employers, how do you work around not being able to share electronic medical records smoothly, such as having to fill out release of information, working with HIPAA regulations versus being members of the same entity? Also, has anyone seen symptoms of long COVID for student athletes, and how are you helping treat that?
So I think, I can definitely speak to the HIPAA side of things. I think I'm probably one of the more rigid providers out there. So we actually are in the same medical, electronic medical record that the rest of the university health system is on. So we are, like Randy had mentioned, medical autonomy and decision-making earlier at the University of Michigan, and this is going to look different across the conference. We are in the same system as Michigan medicine providers, UHS providers, but that doesn't mean that we are just engaging freely in conversation with coaches or with one another for that fact without getting release of information. The one thing I will say that COVID has increased us in doing is we've actually put all of our release of information documents online. And so now they can be signed electronically, so it makes it a little bit easier for our student athletes. But we're held to the same federal and state statutes that anyone else is. And so our student athletes care, and that comes first. And we don't share that information if our student athletes are saying that they don't want that information shared. So they have, that is their medical information, and they have the right to withhold that from anyone.
And I think that's one of the challenges, is for a lot of coaches, for a lot of athletic trainers, for a lot of academic counselors, they're so used to just knowing everything. And so I think it's just constant education that our mental health and our sports medicine staff have to be doing for all those various entities to help them understand HIPAA and FERPA and its role in student athlete confidentiality, because obviously we don't want our coaches going directly to our mental health counselors and pressuring them, again, that medical autonomy piece. But there has to be a constant regular reminder about confidentiality with all of our various entities, because for college athletics in general, the information flows, be it from recruiting and a host of other areas, and this is one area in which it doesn't, and they just have to be understanding and just be reassured that we're going to take care of them and they're being supportive. And unfortunately, that's all I can tell you. They're being supportive and they're taken care of.
Whoever attended a sports psychology ethics-based session, whatever, this is the topic that is almost 90% of what we talk about. This is the most common ethical dilemma that any provider that does this sort of work runs into. Same thing Abigail said. I'm super strict about it, and I know there's plenty of people who aren't happy about it. There's a lot of forms, and as Abigail said, electronic forms have now become my friends. It's no longer having to print them out. But that is the most common ethical challenge and thing we run into every single day doing this. And I think it takes a lot of fortitude from good providers to make sure they stick to that and don't cave when they get some pressure from coaches or whoever it may be at times.
Okay. Well, we have 4 minutes left. I don't see questions in here, so I'm going to make up questions that I'm really excited about that I wanted to ask. Okay. So something that I think is really important, and I think Brad was the last one to mention this, was there are just people that don't believe in mental health, right? And that I probably encounter that once a week. I'll talk to someone and they'll be like, well, what really good is the conference doing? I'll be like, oh, we're doing all this great stuff with mental health. What else are you guys doing? And there's a dismissive response. There's a complete just lack of knowledge response. In this crew's opinion, I guess, in just the 4 minutes that we have left, maybe you guys can share success that you've had with breaking through to people that really do not get it, whether they haven't experienced it or they don't know people that have experienced it, or maybe they have it and they're not willing to own it. What type of ways can we be more inviting to the topic that can get people to understand not only its importance, but the need for funding, the need for help, the possibilities that exist if you do get treatment or you do seek help from people, and how much better your life can be? Some people, they feel the need to continue to grit their teeth as opposed to looking at anything that could help them because they have fear of whether it's exercise or whether it's medication or whether it's therapy or whether it's talking to a friend or whether it's talking about their feelings or whether it's meditation or the hundreds and hundreds of different things that you guys are actively practicing to help people. Can you maybe talk about a case of someone who just was so far not involved in it and then became someone that was like, this is amazing, this changed my life, it's changed my family's life? What can we do to get people more, not excited, but more just take more ownership and believe in it and recognize its importance in everyday life?
I guess I can start. So I think a big thing is, one, we show up every day. So I think our presence in being available for conversations is extremely important. We are people that, we come with a lot of data and facts, and I think sometimes that is not appealing to folks, but ultimately having access to that information is really helpful. And then also patience. If we can, say, these are some things that are going on, these are some themes, these are some trends, what role would you like to play in helping make this be a safe, healthy, and equitable environment for our student athletes? We typically see people increase their level of investment. And so, it really is a collaborative process. And I think the more available we can be, the more likely, and the more I've seen, people that typically are dismissive of mental health, like they join the team.
I think something that come to mind immediately, Adam, when you brought it up, is just understanding the language you're using to talk to the folks that you're talking to, understand the audience you're speaking to. So if I'm trying to convince a coach, I can't walk into the coach's office and start talking about emotional well-being, but I can go in and talk about how we can work on arousal regulation, because arousal regulation lets you manage a stressor better when you're having to compete, which is just a fancy way of saying work on your anxiety and learning how to manage anxiety. But a coach doesn't want to hear that, right? Or on the opposite end of the spectrum, if I'm working with an administrator or a university administrator, if I can find a way to help present what we're doing as a way it's going to save you money, or it's going to make something more efficient, or it's going to help you. I mentioned earlier, we're going to start doing ADHD testing in that in-house. When we start making some of that happen, as I shared, this is how much it costs when we send it out. And so this is how much we'll save by doing it. Now we can offer a new service. So I think the more you understand your population and then speak the language that's going to communicate to them. I can't walk into an administrator's office and use, the same language I would talk to Abigail and Michelle about it, because Abigail and Michelle are already on the same plane that I'm on. So I think it's the large part is just understanding your audience and making sure you're speaking to what they want to hear and how you're going to help them.
I think this is a
Can I ask one more question?
Oh, sorry.
Oh, sorry, Michelle. Go ahead.
I was just going to say that's a really big question. And there's so many different directions, even as we've heard from Abigail and Brad. And I think what Brad said about knowing your audience is really important. I'll kind of break it down to the individual level. If I end up talking to someone who gets into my office but really isn't ready to be there, I oftentimes hear like, I should just be able to figure this out on my own, right? Like there's nothing wrong. If you look at my life's great. Like why I shouldn't feel this way. I don't need help. And so just kind of also normalizing it too. I like to make the physical, mental analogy often, right? Like, okay, so like if your ankle hurts and you feel like you should be able to do it on your own, like would it still maybe help to see a doctor or an athletic trainer to help them give you some strategies or tips to get better, maybe faster than you could on your own? And so talking about mental health in a similar way, maybe you could do this on your own, and it's also okay to have support to help you kind of build on the strengths that you already have. And if there's something not going great, help solve that as well.
I have one more question. I know we're over time. I just don't care. I want to care, but I don't. And I think this is really important. And I'm so happy that I thought about it. How do you help student athletes communicate the problems they're having to their parents and their friends? I always wonder that when I'm talking to student athletes, like it's a huge burden for them. And then maybe they come to the realization that they have anxiety or they have depressive symptoms. It's a whole nother world to then call their parents or call their whoever it is in their life and share it. And who should they share it with? Who should they not share it with? And some people do need to know, right? Like that are very close to them that should be, see those signs. I feel like that's like a whole nother path. And I'm so curious. I know we're out of time, but I really wanted to get that one in there because I think that could be really useful for the group.
Well, I think one of the things, and I know I said the word too, but like the word should, right? Like, what does that even mean? Like, who should know? Like, I don't know. And so I always like to say, like, no one wants to should themselves, right? Like, we don't want to should ourselves. And so like, maybe like think about like, who might it benefit you if they know, right? Who can your supports be? And sometimes it's not the parents. Sometimes it's not your coach. Sometimes it's not your friend. Figure out who the supports are, who can be most beneficial in helping them through the process. And also, potentially if some individuals in their lives are barriers in kind of enhancing overall mental well-being, helping figure out ways to talk with them about that. And so I think it really is an individual basis. I don't know that there's always this person in your life is the one that we need to make sure we tell, but like really figuring out who are going to be their supports and then how what they share can help with that support.
Thank you, Michelle. Okay, well, we're going to wrap up now. I know we're 2 minutes over. Major thank you to Randy, Brad, Abigail, Michelle. Major thank you to everybody that's been viewing. If you have any questions, we're available, or at least I'm available. You can always email us. I dropped my email in the chat. We're really grateful for the attendance, and we're really grateful for the discussion today. A really, really critical topic. And just again, thank you to the panelists and everybody viewing.
Thanks, y'all. Go Blue.
There it is.